Hello, this is Dr. David Green, CEO of the Mid-Atlantic Pain Network. Today's topic is the basics of kyphoplasty for vertebral compression fractures. Over 700,000 compression fractures occur every year. Most of those are due to osteoporosis, and a lot of them actually go unnoticed because they aren't painful. Half of women and 25% of men will have an osteoporotic fracture in his or her lifetime, either of the spine or of the wrist, the hip. Once a compression fracture occurs, the risk of additional fractures in adjacent vertebrae increases fivefold. So the symptoms may include a sudden onset of back pain that worsens while standing or walking, limited spinal mobility, aches, spasms. Could be height loss, deformity, and or disability. This is the downward spiral. You have the back pain, you have the fracture, then the back pain, and you start to get some deformity because you can get multiple fractures, you lose height, you start to get pushed forward. It's called kyphosis. This can push on the lungs, so you can decrease lung capacity, impair the function even more. You can start to push on the stomach and lose appetite. You can start to develop problems with sleeping, decreased activity, so you get worse osteoporosis, more bone loss, the fracture risk goes up more, you get worse lung problems, and then it spirals into a 23% increased mortality. What are the treatment options? Well, if the pain's not that bad and the deformity's not that bad, you can do benign neglect. Just kind of watch it and wait and see what happens. Medication management may include over-the-counter pain medications, anti-inflammatories, Tylenol, narcotics, muscle relaxers. Here's a typical brace. There's actually a point of compression up here over the chest, one in the back and one in the abdomen. That's called a Jewett brace, and it's been pretty effective over the years. There's also one that goes all the way around called a TLSO, and that's got a ton of support, but it's also a lot more bulky. So vertebroplasty procedure was invented back in the 80s, specifically for cancer fractures. Eventually, about a decade later, it started to get used for regular osteoporotic fractures because it works so well. It's an outpatient procedure, it's very low risk, and it provides typically instant pain relief. What you'll have is a catheter going through this bone here called the pedicle. This is the spinal canal. You want to avoid that. It goes in, you get into the fracture, and you squirt in cement. Okay? And a lot of people will go on both sides, called bilaterally. The kyphoplasty is an evolution of the vertebroplasty procedure. So it was FDA cleared back in 1998, but it really didn't become very popular until about 5 years later. It is very similar to vertebroplasty as far as how the catheters are put into the bone, but what happens is a balloon filled with saline is inflated first, and then that's removed, and then a lot more cement is put in under much lower pressure than with the vertebroplasty. Here's the steps involved for looking at it from the side. Catheters put into the fracture. As you can see, there's lost some height here. The balloon is then inflated with saline, so you can see where it's gotten back some of that height and created a bony void. The balloon is deflated and removed. In its place, you have bone cement being put in, and that ends up staying. It hardens in about 20 minutes. What are the outcomes? Well, typically it's immediate pain relief from the stabilization. It's almost like an internal cast. The person may have some aches and spasms that continue for weeks. Most of it goes away immediately. Over 90% of patients see dramatic pain relief immediately with significantly increased function, including walking and performing activities of daily living. There have been several of these studies. There have been some studies showing questionable benefit, but they are far outnumbered by the ones showing incredible pain relief. The top non-operative pain management in the Mid-Atlantic area is with the Mid-Atlantic Pain Network. There are several clinics throughout the Mid-Atlantic region accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Green with the Mid-Atlantic Pain Network. Your pain stops here.